I'd like to welcome you to the opening ceremony of the 6th Annual South Carolina Patient Safety Symposium, Orchestrating High Reliability. I'm Rich D'Alberto. I'm the CEO of Lawrence County Healthcare System and Chairman of the Board of the South Carolina Hospital Association. On behalf of the symposium sponsors, and I'll mention who they are, Blue Cross Blue Shield of South Carolina, Health Sciences South Carolina, PHTS Services, Mothers Against Medical Errors, and the South Carolina Hospital Association, I want to thank each of you for being part of this event. Let's give them a round of applause. Someone once said, every person is important. It doesn't matter whether you play the violin, the flute, the cello, or the drums. You're still part of an orchestra. Delivering safe, reliable health care is like performing a symphony. An ensemble of skilled and committed people working in unison can achieve something deeply meaningful. We live in a healthcare environment that is rapidly changing. We're having fewer and fewer dollars available, but greater and greater expectations for performance. I'm going to stray from my script for just a second. And many of you here have probably heard the saying that we are going to have to do more with less. And then we said we had to do less with less. And then we said we have to do better with less. Now we have to be safer with less. Now more than ever, we must be in tune with each other. A great example of the extraordinary teamwork is Safe Surgery 2015 in South Carolina. We're making sure every member of our surgical teams feel comfortable speaking up. As a result of surgical care is safer and every patient is safer. We're taking a holistic approach to care transitions by engaging community health organizations, patients, and families in a program called PART, Preventing Avoidable Readmissions Together. In the last year, 3 South Carolina regional healthcare markets were ranked as the top 10 performers under the CMS Value-Based Purchasing Program. 9 hospitals successfully reduced mislabeled blood specimens by 90% in an innovative pilot program called the Final Check that was later featured in The Hospitalist. And every birthing hospital in the state has committed to stopping early elective deliveries and introducing measures to improve outcomes for mothers and babies. We need an applause for that. We've written the first movements of the symphony, and we have made significant progress. The next movement is our collective journey towards high reliability with the newly launched initiative, South Carolina Safe Care. We're learning how to apply lessons from other high consequence industries to ours. We're talking to each other, and we're transforming the culture of our organizations. This symposium is a great opportunity to learn from national experts and from one another. So let's celebrate what we have accomplished, recognize individual patient safety champions, and renew our collective commitment to providing high-quality care to every patient, every time. I'd like to thank the staff from each sponsoring organization for all of their work in planning this symposium. I just have a few housekeeping notes before we begin. First of all, I hope you all join us for the luncheon celebrating the Lewis W. Blackman Patient Safety Award winners upstairs in Ballroom A at 12:30. Charleston's premier a cappella vocal group, the Voices of Deliverance, will grace the stage for an inspirational and engaging performance during the award ceremony. Continuing medical education credits and nursing education credit hours are available for this program. In order to receive your certificates, you must sign in daily and continuing education table, which is out in the lobby. Verify your email address and submit a completed electronic evaluation that will be sent to you early next week in order to get your CME credits. Books A Million has a bookstore set up in the lobby, and 10% of the proceeds will be donated to local area clinics. Josh Williams will be signing copies of his book, Keeping People Safe, The Human Dynamics of Injury Prevention, today during the break between 3:15 and 3:30. Selected presentations will also be available to download from the SCHA website sometime next week. Bathrooms are located outside the doors to the right. Very important that chimes will sound after our breaks to get us back in the room. Ask you to please be prompt. Please silence your cell phones and pagers. And if you didn't receive a name badge at registration, pick up your badge at the registration desk during the break. And now it's my pleasure to invite to the stage Dr. Rick Foster to share a special message with us. Thank you.
I tell you, this is amazing. I feel truly blessed to be in South Carolina and to be a part of this amazing movement as we try to create a healthcare system that is safe and effective and reliable for every patient every time. It's hard to believe that this is our 6th symposium. Just fantastic. And I wanted you to know that, as you remember, from I think pretty much all the previous 5 years, Maureen Bisognano, who is the president and CEO of Institute for Healthcare Improvement, IHI, who's been a wonderful partner with us from the very beginning, normally serves as our moderator. And turned out this year, our symposium fell in the same time when the International IHI Forum is occurring. So nothing against Columbia, but she had Columbia and London. And for some reason, London won out, plus it's her conference and she needs to be there. So I'm sure they're fully into that 6 hours earlier than us. They're fully into their conference. But she is in England and was not able to attend, but she wanted to take the opportunity to speak to all of you today. So we've got a special message from Maureen for the group.
Hi, everybody in South Carolina. I really wish I could be with you this year. I treasure my weeks with you because you inspire me with the incredibly robust aims that you've got and the work that you do together. This week, while you're in Columbia, I'm in London, and so I can't be with you this year, but I wanted to send along my best wishes from me and from all at IHI. The work that you're doing there is so incredibly important. It's inspiring, but it's really challenging. As I travel throughout the United States, I haven't found another state that's created such a vision of health for all in its population. So you really are living the IHI triple aim of working on the health of the population, everybody you serve in South Carolina, the experience of care. Your Safer Care Collaborative is working on high reliability and improving safety in hospitals and across the system, and working on cost per capita as you decrease the complications of chronic disease and you decrease complications in hospitals. You are working on cost. The work in the triple aim, the teams that you've got in the triple aim are inspiring. And so I wish I could be with you there, but I do want to say congratulations. If you know me, you know that I'm Irish, and I have this saying that we've got here on the wall at IHI, and I think about this saying when I think about the work that you're doing. The saying says, when you come upon a wall, throw your hat over it, and then go get your hat. And a lot of people that I meet across the United States today, they see the wall, but not you. You don't see the wall. You just go get your hat. So congratulations, everybody, and have a wonderful session this week.
And so just so you know, this is the actual hat she just threw, really. It didn't come from England, but it came from Boston. It's her son's hat. He was willing to share one of his newsboy hats. I also wanted to mention real quickly the painting in the back of the room that people not familiar with it is the painting from I think our first or second symposium, The Edge of Change, and it was done by Tim Floyd. And we unveiled that again, I think at our first or second symposium. A copy of that sits in the IHI office. When you first come off the elevator at their offices in Boston, you'll see that same painting there on their wall. So there's a lot of wonderful connections there. And so we are going to be facing a lot of walls as we go into the future. Let's be comfortable going over those walls together. So the idea is not to take those walls on separately, but together. So we'll be throwing our hats collectively over those walls and then following them over as we move forward. So we're now going to move from an Irish proverb across the Celtic Sea to a Scottish futurist. So we love those Great Britain area and the Isles, and so I want to now introduce Ian Morrison. It is my honor to introduce him Ian is this year's host and moderator. I've been very fortunate over the years to attend a number of conferences where he has served in this role, including the HA's annual leadership summit. He's an internationally known healthcare consultant and futurist, and he will conduct this year's Symphony of Patient Safety. The primary duties of the conductor are to unify performers, set the tempo, execute clear preparations and beats, and to listen critically and shape the sound of the ensemble. I hope you notice that we're really trying to play this music theme very heavily. And as a musician from the day when I was in the 6th grade on, I love the music theme very much so. Ian is a renowned expert in the changing environment surrounding businesses and healthcare. He combines research and consulting skills with an incisive Scottish wit to help organizations plan for the future. Ian has written and lectured on a wide variety of healthcare topics for government, industry, and many nonprofit organizations in North America, Europe, and Asia. He has worked with more than 100 Fortune 500 companies in healthcare, manufacturing, information technology, and financial services, and his recent clients include Pfizer and Kaiser Permanente. He's a frequent television, radio, and print media commentator, often called on his talents in forecasting future trends. He is also the author of Healthcare in the New Millennium, Vision, Values, and Leadership. His previous book, The Second Curve, Managing the Velocity of Change, was a New York Times business bestseller. Ian is the President Emeritus of the Institute for the Future and Chair of IFTF's Health Advisory Panel. He is also a founding partner in Strategic Health Perspectives involving the Harvard School of Public Health's Department of Health Policy and Management, and a past director of the Health Research and Education Trust, HRET, the research and education arm of the American Hospital Association. It is truly my pleasure, ladies and gentlemen, to ask you to join me in welcoming Ian Morrison as this year's host and moderator.